Hi, I'm Dr. Edwin Williams, facial rejuvenation specialist, here to answer your questions about facial plastic surgery. Now, I do facelift surgery, but I'm asked, we're one of the top 1 to 2% users of Botox in the country. And that doesn't happen by accident. You have to make sure you're adding value to patients' care and the relationship for people to come back. I think anyone in business knows that. One question we're often asked is, how does the Botox that you do differ from what I'm getting from Groupon? I like to shop and I want to make sure I'm getting value. I want to just share with you my philosophy on that. And again, if you look at, for example, a facelift is not a facelift, or a rhinoplasty is not a rhinoplasty. Someone with 25 years experience is more likely, in thousands and thousands of rhinoplasties, to give you a better and more consistent result. Well, it's the same thing with Botox, or a laser for that matter. It kind of makes me crazy when people say, do you have such and such a laser? Because lasers are just a tool. A Botox is just a tool. A scalpel, for example, is just a tool. What's more important is to make sure that the person behind that tool has the knowledge and the experience to deliver value. Let me give you an example. If someone is treating Botox, for example, in the glabellar area, which is where it's FDA approved, it's used in a lot of other areas, but someone is able to deliver a consistent result that's reproducible at time periods so that you, as the patient, have a nice consistent result, you're probably actually spending less on Botox than if you're jumping all over the place. I hope that makes sense. But that is our goal, is to make sure we're adding value to the relationship. What we find is that most patients who are our loyal customers end up spending less and have more value. For example, we have a rewards program in place so that our loyal customers, by the time you do the math on it, they're not paying any more than people who are jumping around and responding to the Groupon ads or through the least expensive ad. And they're getting the experience of a board-certified facial plastic surgeon evaluating them, not just a family doc. Now, not to pick on family docs or dermatologists for that matter, however, the problem as I see it in the last 10 years, actually since 2003, so maybe 14, 15 years, is that we have had an explosion of options in the last 15 years with a lot less insight into activity. For example, I spent 5, 6 years learning facial plastic surgery, learning the aesthetics, learning aging, and understanding the subtleties of where you can and can't put material product, Botox. You can't do that in a weekend. And that is why I think we see so many individuals looking a little imbalanced or funny, if you will. And it doesn't take a lot to see that. I remember, we have an office in St. Thomas. I remember about 5 years ago, one of my daughters, who at the time was about 11, said to me, she pointed to a woman, she goes, "Daddy, you see that lady over there? She's had like some bad Botox." Now, when I looked at her, she had too much material product in her lips. But even an 11-year-old can look at someone and know that something's not right. My point is this: when things are done well, they're not seen. A facelift that is done well is not seen. You can't tell by looking at someone when they have a nice result from a facelift or they have a nice result from Botox. All you see is the work that is not done well. So I just want to make that point, that Botox is not Botox is not Botox. It depends on who's doing it, their experience, their understanding, and how long they've been doing it. So we don't advertise. We do very little advertising compared to a lot of folks. Yet we're in the top 1 to 2% of Botox users in the country, and I think there's a reason for that. It's because we do it and we do it well. So I hope that answers your questions on am I better off shopping for Botox using Groupon or some other discounted service. So thank you for watching.